Welcome back to the Humble Healer podcast. Thank you for tuning in. And this is Dr. Quang Lei, family medicine physician. And today I'm going to be talking about the flu um, season. And I live in New England, Massachusetts. And the past several years now, the flu usually starts around Christmas time and beginning of the year. So may not be too early to talk about the flu, especially if I'm encouraging and trying to convince everyone to get the flu vaccine, not only to reduce risk of serious illness, especially in the population older than the age of 65, but also to reduce suffering because during the flu season, I see flu patients almost every day at work, and it is not fun to have the flu. And when you come in to see me at the super urgent care, that's you don't look too good. And I usually have to give treatment to help patients feel better with the flu. So just hate to see anyone coming down with that. And overall, those who get vaccinated don't are almost a lot less likely to suffer more severe symptoms and also more severe illness and complications. Let's start with the epidemiology in terms of some information, general information about the flu, which is the biggest cause uh, upper respiratory tract illness worldwide, and it's the cold weather virus in predominantly in the northern hemisphere, usually from November to March or April. But because of COVID pandemic, sometimes we see the flu throughout the summer last year. Nothing surprises me anymore about the timing of the flu. Um, for the past few months, we haven't seen much of it, and I haven't diagnosed a flu case for the past few months. There are flu A, and then there are flu B, and flu A is the most common and the cause of the Spanish flu and the other big flu pandemics, and also the swine flu epidemic. So that's more common. But the presentation, the way the symptoms are all similar to flu B. And children have the highest prevalence of flu infection. And when they're infected, they have a higher viral load than adults, so are more likely to spread to others. And the elderly population is the most concerning because patients over the age of 65 have the highest mortality from the flu. And they did a study in 2015, which was considered a mild year for the flu, and there was still 4,600 deaths in the US from the flu. So it kills. Uh, One more reason to get vaccinated. So most years, death from the flu is seen primarily in the very young and the very old. And in a pandemic year with high mortality, the increased death rate is actually due to an increase in mortality among those in their 20s and 40s. So, how do you know you have the flu? They're usually pretty easy to differentiate between flu symptoms and cold symptoms because flu symptoms are a lot more severe with higher fever, terrible headache, and body aches. And I've been told many times by patients that they felt like they were hit by a ton of bricks, and just the headache, the dehydration, the bedridden. So those are usually more flu-like symptoms. And the fever sometimes we get up to 104, 105. So it's pretty nasty inflammatory response by our body against the flu. Versus the cold, a lot of time it's just some cough, runny nose, some sore throat, some nasal congestion, and so on. And typically much milder. And they look at 3,700 patients with flu. And of those that had the flu, 93% had cough. And from my experience, most of these cough are dry cough. And 68% had fever, 91% had some nasal congestion. If patient had cough, fever during the flu season, 80% chance that they actually had the flu. Complications of the flu, we can get viral pneumonia or bacterial pneumonia. Patient can get flu bronchitis, and I've seen flu tonsillitis, sinus infections, ear infections, and also worsening of chronic health conditions such as asthma, congestive heart failure, and COPD. So, how do you prevent the flu? Now, in terms of treatment, let's start with treatment. We can talk about Tamiflu and so on. Decision is based on the risk of the patients developing complication from the flu. CDC and other healthcare organizations consider children less than 5 years old, especially those at 2 years of age, or those 65 years and older, and women up to 2 weeks postpartum, and residents of nursing home and other long-term care facilities, and also some cultural populations, including the American Indian and Alaskan Natives, who are at higher risk of flu complications. So these populations are considered high risk and maybe more likely to benefit from getting the Tamiflu. And also patients with chronic medical condition like asthma, neurological disorder, heart condition, blood disorders, endocrine disorders, liver disorder, kidney disorders, weakened immune system, history, BMI over 40, with this morbid obesity. So in those patients, it's more likely the Tamiflu may be helpful. They did a study on oseltamivir, which is Tamiflu, which is commonly used. And unfortunately, two of these studies were drug company sponsored, and also 8 other studies were withheld. So meaning that the results would they had the result, but for some reason they weren't released, and they only released the result from 2 studies. So you can tell that that was biased already. But eventually, all the data were released, and it was found that there was very minor benefit to using oseltamivir, which is Tamiflu, and on average, there is a 24-hour reduction of symptoms, and the sooner you start, the better. The study also did not find a reduction in the rate of hospital admission or hospitalization, and also did not reduce the development of pneumonia. And the side effects are not insignificant, and including gastritis, nausea, vomiting, and I have treated patients coming in after they were treated unnecessarily for the flu with Tamiflu, and ended up developing very uncomfortable gastritis symptoms with nausea, vomiting, full abdominal pain, and not being able to tolerate diet, and it's very uncomfortable. And all that for to reduce the fever duration by about between 16 to 24 hours. Also, there are some odd spike in psychiatric symptoms, including hallucination and delirium, and mostly seen in Japanese children caused by the Tamiflu. And it costs generally about $120. It's supposed to be effective in about 58% of cases when it is used to prevent flu illness in family members. So the bottom line is that the mainstay of treatment is supportive IV fluid for those who need it due to dehydration. I usually also give anti-inflammatory medication such as ketorolac, and I also add the Tylenol, 1,000 milligram, for those patients. And if they have asthma symptoms, I treat it for asthma. So overall, um, you try to help patients feel better. And if they have cough, severe cough that keep them up at night, you give them some medicine to help them sleep better at night times. Mostly supportive, mostly reassurance. Make sure patients do not show signs, symptoms of complications. So those are the mainstay. Now let's talk about an important part of this talk is the vaccination. Before that, let's talk about the diagnosis. They have rapid flu swab, which they do sell now these days with COVID flu, and some even sell RSV swab. And consider in the healthcare setting, it's not considered very good test. It only picks up about between 50 to 87% of the cases, and more sensitive in children, meaning that it picked up the disease better in children because they have a higher viral load. When the flu test is positive, it's a very good test, and when it's negative, doesn't necessarily mean that you do not have the flu. So a positive test is more reliable than a negative test. And then for vaccination, we try to match the seasonal strains, flu with flu A and flu B. Some years it's more effective than other in preventing flu-like illnesses and complications. Um, it's at this time I'm not sure how effective the current flu vaccines are, and it tend to work better in children, which can prevent certain serious illness and complication. And there is one fatal and very dangerous complication, which I will talk about after this, um, in children previously completely healthy, which is very, very tragic, involving encephalitis and brain infection. So something that we have to consider, and talk about that with patients and parents. And the vaccine is less efficacious if you are sick when you get the vaccine, because it reduces the immune response to the vaccine. So make it less effective in generating an immune response. And it's been found to reduce the need to seek medical treatment. And so far, they don't have a concrete data to tell us whether the vaccine can prevent complications like hospitalization or secondary bacterial pneumonia. So I'm going to talk about an important and dangerous complication of infection in children. It's called severe flu-related neurologic complication, and this occurs mostly in healthy kids. 76% of this infection, which is called acute necrotizing encephalopathy, from the recent flu season had no medical history. They are completely healthy. So in this case series, one case series, they found a 41 case of this influenza-associated acute necrotizing encephalopathy in kids, and most in kids without any previous history. And this is associated with very high mortality rate of 27% and morbidity, which is 63% of survivors were left with moderate to severe disability. These are previously healthy kids, remember. And the disability include spasticity, where your muscle tone is higher, and dystonia, when you have abnormal body movement, and also patient need a breathing tube and a feeding tube placed. It's just very sad to see that kids having to go through that. So the bottom line is that healthcare, professional and everyone should be reminded that annual influenza vaccination is recommended for all children aged 6 months or older in the U.S. to prevent influenza and reduce risk of severe complications. Even though we do not have a lot of evidence showing it does reduce hospitalization, but it's been agreed by experts that it does have a high likelihood that it does reduce the complications. So it takes about 2 weeks for the immunity to develop after you get the flu vaccination. Please keep time to get vaccinated before the flu hits its peak season. Nobody knows the exact time, but usually late the end of the year toward the beginning of the following year. So get yourself ready. Normally, I do not get vaccinated around August when the vaccines come out, because I think that the immunity generated may wane. So I wait till around this time of the year to get vaccinated. Then I think that the immunity will stay nice and strong and ready for the flu season. So if you have any question or comment, please leave me feedback, and please consider vaccinating everyone in your family to protect yourself. And thank you for checking this out. Please subscribe to the channel, hit the bell notification, and hit the like button if you have not already. Thank you so much. Take care.